The pec minor is going to attach from the coracoid process of the scapula all the way to ribs 3 through 5. And their main action, because they attach from the coracoid process from posterior and then anteriorly to the actual ribs 3 to 5, it's going to be responsible mainly for Hey everyone, thanks for tuning in. Steven here with Team Euphoric, and today I'm joined by Michael from One Body, and today is the start of our shoulder pain series. So over the course of the next month, we're going to be dedicating it towards shoulder pain every Tuesday and Friday at 2 p.m. And we're going to start by doing the anatomy of shoulder pain today. We're going to be going over both the skeletal and muscular anatomy of everything responsible for the exercises that we're going to be doing in subsequent videos. So all of the muscles we're going to be discussing today are going to be responsible for the myofascial stretching and the segmental strengthening exercises that we're going to be doing later on. But first thing that I want to get on is with the actual skeletal anatomy. With regard to the skeletal anatomy, we're going to be focusing on everything in the thoracic spine. So we want to do the anterior aspect first, and some of the actual bones worth noting, or the landmarks, are going to be the manubrium, which is going to be this bone right over here. Then the manubrium has the sternum, which attaches to it. And then this little thing right over here, that is the xiphoid process. With regard to the sternum, this is where all of the ribs are going to attach. And with regard to the ribs, we basically have 12 pairs of ribs. We have 12 on each side, and we have 7 true ribs and then 5 false ribs. The top 7 ribs, those are going to be your true ribs, and the reason they're called true ribs is because they have a direct attachment to the sternum, whereas the false ribs, ribs 8 through 12, those don't have a direct attachment. Rather, they attach through the costal cartilages, which attach to the actual sternum. And then ribs within within those ribs, we can then further subdivide the false ribs into floating ribs, which is going to be ribs number 10, 11, and 12. So again, 7 true ribs, 5 false ribs, 11 and 12 are your floating ribs. Then from here, we have the clavicle or the collarbone. We have the clavicle on each side, and then we have our acromion right over here, and then the xiphoid process. I'm not exactly the greatest artist, so bear with me right over here, but these are going to be the landmarks that we are going to use when we are doing the actual exercises, when we're getting into the actual muscular anatomy. Now that we have covered everything in the anterior aspect, I'm going to have Michael turn around to the back, and we're going to get into the skeletal anatomy for all the bones in the back. We have the thoracic spine. So with regard to the thoracic spine, the C7-T1 junction, what you want to do to find that is you're going to palpate wherever the biggest protrusion is. Most likely, that's going to be where the C7 is. And then you're going to have the patient look up to the sky. And Michael's going to look up. You put your finger where you believe the C7 to be. If the top finger goes in as he looks up, then I know that I was correct at the C7. So right here, that's going to be the C7-T1, the C7-T1 junction right over there. So we have the T1 in that space, T2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. We have 12 thoracic spine. They're numbered T1 all the way through T12. We have our scapula, which is this bone right over here, our shoulder blade. We have one on each side. And then those right over here is going to be the spine of the scapula. And now that we have all of the skeletal anatomy down, we're going to get into the muscular anatomy. For that, I'm going to have Michael turn around, and I'm going to get into all the muscles in the anterior aspect. First thing that I want to cover is going to be the pectoralis major. For the pectoralis major, there's 2 attachments at the origin. We have the sternal attachment, which attaches to the sternum, this bone right over here, and then we have the clavicular attachment, which is going to attach right over here. Both of them, they are going to come across and attach right into the humerus. And with regard to the pectoralis major, because its fibers run horizontally, we know it's going to be responsible for abduction of the humerus. So adduction, adduction, is when you bring your arm across the midline. It's also going to be responsible for flexion of the humerus, so bringing the arm straight up, and then also medial rotation of the humerus, turning the arm in toward the inside. And that is the pectoralis major. Next, we're going to take a look at the pectoralis minor. The pec minor is going to attach from the coracoid process of the scapula all the way to ribs 3 through 5. And their main action, because they attach from the coracoid process from posterior and then anteriorly to the actual ribs 3 to 5, it's going to be responsible mainly for protraction of the scapula. So bringing the scapula forward. Next, we're going to take a look at the shoulder. At the shoulder, we're going to take a look at the anterior deltoid. The anterior deltoid is going to attach from the lateral clavicle, the acromion, and then it's going to attach into the deltoid tuberosity. And because it attaches anteriorly and laterally, what it's going to be responsible for is abduction of the humerus, so bringing the arm out to the side. It's also going to be responsible for flexion of the humerus, bringing the arm out, and it's going to be responsible for medial rotation of the humerus. So it has the exact same actions as the pectoralis major. Next, we're going to go ahead and take a look at the biceps brachii. For the biceps brachii, we have a short head and a long head. The short head is going to attach from the humerus to the elbow, and then the long head is going to attach from the shoulder all the way down to the elbow. So because the long head of the biceps crosses both the shoulder and the elbow, it's going to have two main actions. It's going to be at the shoulder, responsible for flexion, specifically initiating the first 10 to 15 degrees of shoulder flexion. And then at the elbow, its main action is going to be flexion of the elbow. It's also going to have a component of supination of the forearm. So whenever you flex the forearm and supinate, that is your biceps brachii, the long head, working. And then the short head, because it doesn't cross the shoulder, it just attaches from the humerus to the elbow, its main action is just going to be flexion of the actual elbow. No component of flexion at the shoulder. Next, we're going to go ahead and take a look at the thoracic diaphragm. With regard to the thoracic diaphragm is going to attach from the xiphoid process, the sternum, the rib cage, all the way around to the thoracic spine, and then it is going to insert into the tendon of the diaphragm. And its main action is going to be to depress the actual diaphragm. So when it contracts, the diaphragm is going to go down, it's going to expand the abdominal contents, and it's going to allow for greater expansion of the thoracic cavity. By allowing the thoracic cavity to expand a lot, it's going to allow for greater oxygen to get pumped into the lungs. So that is the main action of the thoracic diaphragm, and this is a very abbreviated version of what all of these different muscles do. They do a lot more than just that, but we're not going to get into all the microanatomy. That's going to be for our lecture on September 18th. So if you do have issues with shoulder pain, definitely check out that lecture, again, September 18th. And now that we've done all the muscles in the front, we're going to get into the muscles on the posterior aspect.
Okay, we're going to go through the anatomy for the posterior chain. Stephen has now turned his back to us. And we're going to start off with the trapezius muscle. The trapezius is a kite-like muscle that comes all the way up from the top here like this and works down through the scapula all the way down to down here, just like this. Common area attachment is also on the thoracolumbar fascia, which is a fascial point down here. And the trapezius has many different actions depending on where you are. On the upper portion, it is for elevation. And in the mid portion, it's for pulling back the shoulder blades. And in the lower portion, it's for pulling down the shoulder blades and creating stability there. In the middle here, there's the rhomboids, which are attached at the scapula in the middle here and to the spinous process right here, and their job is to again pull the blades in and away. That's the go. That's the rhomboids major. Rhomboids minor is higher up, and it has a very important job because its attachment is at C7 where there's notches here, and what that does is that essentially pulls the head back for Stephen. So it's a good postural muscle to work. And again, that action works on just pulling back and down. There we go. Excellent. And now we have the spine of the scapula right through here, and above there inside here is where the supraspinatus is, and it attaches here at the greater tubercle of the humerus, and its job is to start the elevation of the arm into this line here. And that muscle is an extremely important muscle to take care of because typically if the clavicle has gone forward and there's internal rotation, there's not much space for that. That tendon can get frayed. In addition to that, this can create a lot of stability for the shoulder by allowing it to have space to lift inside here. Good. Okay. Posterior deltoid is up here attached at the greater tuberosity, and its job is to pull the hand back into extension and abduction and external rotation.
And there you have it. That was the anatomy of the musculature and the skeletal anatomy that is responsible for shoulder pain. So if you are somebody that has shoulder pain, we're going to be getting into exercises, both myofascial stretching and some segmental strengthening exercises that you can perform for all of the muscles that we listed today. Those will be coming in subsequent videos every single Tuesday and Friday at 2 p.m. This Friday at 2 p.m. you could check out our assessment video. We're going to be going over different assessments in the thoracic spine to determine why exactly you have shoulder pain. And then if you do want to get into a little bit more detail with the anatomy, the assessments, and also the different exercises, come to our seminar on September 18th. But that's pretty much it for today's video. If you guys have any questions, go ahead, drop a comment down in the comment section because we would love to hear your guys' thoughts. But that's it for today's video. If you guys enjoyed the video, be sure to smash that like button so we know to continue making these types of videos in the future. And if you're either new to the channel or haven't subscribed yet, be sure to subscribe to the channel and hit the notification bell, as we will be uploading new videos every single day. That's it for today's video. Thanks for tuning in, and we will see you again tomorrow.